Good morning, everyone. On the behalf of Team Dentist Channel Online, I would like to extend a very warm welcome to all of you. I am Dr. Aditi Mishra, and I'll be the host for today's session on the topic Communication, the key to success in your dental practice by none other than Dr. Jayana Gandhi. So, before starting with the session, I have few housekeeping notes to make. If you have any doubts during the session, you can put your questions in the question and answer box, and each and every question will be taken up at the end of the session. If you have joined us from Facebook and YouTube Live, you can ask us questions by commenting, and each and every question we can take at the end of the session. So, without further ado, I would like to introduce our today's speaker to everyone. Dr. Jaina is a well-renowned expert pediatric dentist with over 11 years of diverse experience post-graduation. She has completed her bachelor's with first division from Kurukshetra University and master's in periodontics and preventive dentistry from Pandit B.D. Sharma University of Health Sciences, Rohtak. She was associated with India's largest dental chain, Clove Dental, for over 7 years, where she was the leading Gurugram zone as deputy zonal clinical head, apart from donning many other hats for the chain. She is currently practicing as an independent consultant across select clinics in Gurgaon, prioritizing time for her own interests such as mentoring, teaching, and public speaking. Over to you, ma'am. I'm sorry, ma'am, your voice isn't audible. Can you please? Okay, ma'am. Okay. Okay. So, meanwhile, our speaker is not able to log in right now. So, meanwhile, I'll just give a brief introduction about today's event. And basically, this is a brief introduction about the upcoming online workshop that we are having on communication. Basically, this session is to give you an edge over how to win more patients than other, because we everyone knows that at one place there is a lot of competition. So how can you win over a patient? And it is just because of the communication part. So this is one brief introduction. This session will be one brief introduction, and on 13th of March, we are having online workshop on communication, the key to success with Dr. Jaina. So those who are interested, and I request everyone to kindly join in the session and learn the skill of communication, because everywhere this skill is going to help you a lot. Ma'am,
Am I
can you?
audible now?
Yes, absolutely, ma'am. Please go ahead. Ma'am, I guess there is some issue with the voice from your side. Because we cannot hear you. So, can you please just try to connect with the headset or the system sound once? We cannot hear anything, ma'am. Okay. Ma'am, you can hear me, right? Questions we can take at the end of the session. So, without further ado, I would like to introduce. Uh, we are really sorry to all the participants. Actually, the speaker is not able to connect with the audio, so she's just trying. And meanwhile, we'll do the introduction part. I'll be introducing you to our organization, which is Dentist Channel Online. So this is our organization, Dentist Channel Online, with the motto "Healthy Smile that leads to wealthy lives." I request all of you to kindly save this website, and you can log in. We have launched a new website, so you can log in and check all the details. Our organization is India's first digital dental marketing media company, which is striving very hard to bring all the dental professionals, dental event managers under one roof. And we organize a lot of events every year, every month. And being a Prime member, you can avail a lot of benefits out of it. So we request you to kindly subscribe to our Prime membership as soon as possible. And it will just cost you 499 rupees for an annual membership. This is one sample e-certificate which you'll be receiving after completing your webinar. And this is only for the Prime members. Okay, I request all the participants to kindly take a screenshot of the slide, save this number, and send one message containing your full name on WhatsApp so that you're added to our broadcast list. And after that, each and every update will be updating you with each and every update, like whatever upcoming events that we'll be having. Our sponsors, innovative dental and healthcare solutions to ensure your success, generic implants and prosthetic solutions. Those are mine. Okay, those who have missed out any of our video lectures, you can go back on Facebook and YouTube and watch the recorded videos there. And you can follow us on Facebook using our handle Dentist Channel Online for all the updates. Okay. I request the I hope I'm audible to everyone. Can you just give me one text, any of the participants? Can you just give me one text in the chat box to confirm? I hope I'm audible to the participants. Can someone just confirm me in the chat box? And so we have our doctor with us. Ma'am, can you hear us?
Blur. Can you hear me?
Yes, absolutely, ma'am. Please go ahead.
Just a second. Just a second.
Right. So we have our speaker with us, and we'll be starting with our session soon. So thank you to all the participants for being so patient, and sorry for the technical glitches. Meanwhile, I'll just introduce our speaker again. Dr. Jaina possesses exceptional clinical skills in cases of full mouth rehabilitation of children with early childhood caries, including root canal treatments, restorations, extractions, crowns, space maintainers, interceptive orthodontics, and preventive dentistry, both chairside under general anesthesia. Her core competencies include expert knowledge of her subject, superior patient handling capacities, especially children with behavioral problems and handicapping conditions. She has also
Am I audible to everybody now? Hi, viewers. Am I audible now? All right, great. So, Dr. Aditi, if it's okay, I can take over now. All right, great. Thank you so much, and really sorry for the technical glitch that we faced. I just moved to another system, and I hope this one works better now. So, like I was mentioning, I would like to thank Dr. Aditi for having me on this platform. And
Ma'am, please go ahead.
before we start, I start talking about what all we're going to deal with today, talk about today, and in the masterclass a month later, I would like to show you a small video on why and how communication is important and how it matters in our dental practice. So please do let me know if the audio it's visible to you. Just a minute. Mhm. Is it audible?
Um, Video is there, audio isn't there.
Audio isn't there?
No, ma'am.
क्या करूं? Maybe we can just capture whatever is visible and then I can talk about it. So I'll let it
Sure,
stay
ma'am.
on for a minute. Mhm. All right. I'm sorry you could not hear the video, but I still wanted everybody to have a look at the video. I am sure you would have gathered some insights on how communication is important, uh, in day-to-day, daily, our dental practice. So moving on to my presentation now. Uh, I'll share my presentation now and we'll begin with that. Thank you so much for your patience, everybody. I know it wasn't a great start. We had a lot of hitches. So the presentation and the video was basically to show that why communication is important and how communication is important. And it's the key to a successful dental practice. So, I have heard a lot of my colleagues in the initial days of my practice and, a lot of fresh passed out dentists who come out and they have the same question that the patient came to us, we gave him a treatment plan, and despite that, we told everything, and despite that the patient went and got the treatment done from some other dentist. So before we are able to take the patient to our dental chair, there is a lot that happens before that, and that is where the role of communication comes into play, because how we talk, how we communicate, what all we say to our patient matters more than what we actually do. Of course, does not matter that our skill is not important or we don't have to perform a good treatment, but before we are able to show our dental skill and do a good treatment, it is important that the patient gets converted and comes and sits on our dental chair for getting that treatment done. So like you saw in the video, how one of the dentists, he was unprofessional and did not have great verbal and non-verbal communication skills, versus how the other doctor, the other dentist, who was great at his behavior and communication skills. What a great difference there was. And I'm sure all of us want to be and are like the second dentist over there. So, in communication, we'll be talking about verbal and non-verbal communication. I will be starting with the verbal communication first. And like we saw in the video, the problem with communication is that it's the illusion. We feel that it has been accomplished. We have said everything and, everything is done. But it takes a long way to reach the patient's mind and heart and actually convert the patient and get him to our practices for getting the treatment done. So, if you communicate skillfully, you can work miracles. If you just communicate normally, you can definitely get by. There's no doubt about that. But if you communicate skillfully, you can absolutely work miracles. So there are 5 C's of communication that I always talk about, which are care, concern, compassion, confidence, and competence. Now, we as dentists obviously have competence in our dental skills and confidence because we have done our graduation, our post-graduation, and we are dentists. So confidence and competence are the 2 skills which are already, existent in us. And the skills that we need to hone or sharpen or work upon are care, concern, and compassion. Everybody likes to get a great treatment done. So whenever we are treating a patient, we have to think that the treatment has the way we would like ourselves to be treated, the same way we have to treat our patient as well. So these are the 3 C's: care, compassion, and concern, that we need to sharpen and hone in our practice, and bring in an element of empathy as well. The other different elements of communication in verbal aspect are explaining, questioning, listening, clarifying, repeating, and goal setting. So, while when we'll be doing our master class, I'll be sharing examples on each of these aspects, on how to explain different treatment plans to the patient, on how to question and ask questions, from the patient related to what his issues are and what his wants and needs and expectations from the treatment are. Listening, it's a very important skill. Nobody listens these days. So listening, we'll be talking more about it towards the end of the presentation. Clarifying, once we have heard the patient's doubts, clarifying, rephrasing and paraphrasing whatever we have heard of, repeating the same thing, and finally setting a goal. So once you set a goal in the end, that okay, this is what our treatment steps are going to be and our treatment plan is going to be, and that is how we are going to start. So we'll be dealing with a few more things here in the presentation. Patient conversion and retention. So, once the patient comes, like I said, converting the patient for treatment and then retaining the patient for a long time. So it doesn't just end there, that today you are treating the patient and then our profession, that the patient comes back to us for further treatments or for follow-ups. So our aim as dentists should not just be to treat the patient, it should also ensure that the patient is able to maintain their good oral health in the future as well. So as a pediatric dentist, I always tell all parents of my pedo patients that, I would rather spend 10 minutes extra on your consult, but I would want you to understand why this issue happened, how this can be corrected, what will happen if this issue is not corrected, and what benefit will your child have, or will the patient have once we do this corrective treatment, and then how follow-up is important. So just a few tips and tricks on patient conversion and retention. Well, chat with your patient about his or her life in the first few minutes. This is the first and the most important step in building a rapport with the patient, right? To break that ice. Now, imagine, you go to a doctor who just tells you, okay, you go and you say, I have fever, and the doctor says, okay, this is the medicine you need to take, and that's all. Versus you go to a doctor who spends 2 minutes, talks to you about yourself, about, what you do. Don't you start feeling that connection with anybody who's in family? If you talk to people, if you develop a connect or rapport with people, it takes you a long way. So that is where the ice breaks. Of course, there's a very fine line. You don't have to go on chatting about their personal life or about your personal life, but just lightly on how you're doing and how was your day and what do you do. Like I ask all my pedo parents, oh, so what school does your kid go to? Okay, so my kid goes to this school. So in general, just a chat to for the initial conversation to break the ice. Next is learn something new about your patient, write it down. So say, for example, a patient comes to me and says that, doctor, I am preparing for an important exam and my exam is scheduled next month. And, I'm really working hard towards it. And now when after a month, the patient comes back to me, obviously it's not possible for me to remember every small detail, so I take it down in my notes in my software wherever I'm taking my notes. And when the patient comes back the second time, I pick up the conversation from there so naturally. So you were telling me about the exam that you were preparing for, how did it go? And or you were preparing for a college admission, or you were traveling, how was your travel, anything. So you pick it up very naturally from the last step where you left it at. The patient again feels that warmth and connect and that empathy, that care and compassion, all those things. And again, helps him build that faith and trust more in you. Try to know more and more about the person each time the patient visits you. Talk more and more about what he does, what his interests are. Listen to him. Give real compliments, genuine appreciation. I'll share another example with you on this. I had an old lady as a patient. She was getting a full mouth implant rehabilitation done where I was working, and she was in. Her husband was in army, and every time she would visit for her appointment, she would be wearing a new sari. And I remember that every time I would go and compliment her genuinely. So when we say real compliments, genuine appreciation, heartfelt, honest appreciation, that, ma'am, you're looking very graceful, you're looking very elegant. And, that would bring a smile on her face. And, I remember, even though I was just the primary dentist, as in I was the one who consulted her, who gave her the treatment plan, who basically converted the patient to the treatment. We had an implantologist on board who did the procedure and everything. But every time she would still look for, she would ask, okay, where is Dr. Jaina? I would want to meet her. Today she's not there. She even once said, oh, she, at least when I meet her, she compliments me. So this just makes a person feel better about himself or herself, and helps to develop and strengthen the bond with you, your clinic. It also shows the positive environment in your clinic. So the patients want to come back to you because people are smiling, people are laughing, or there is a general positive happy atmosphere all around. The next one is know your patient's name and use it often in the conversation. So again, that is very, very important. Everybody's favorite word is their own name. So if I can remember my patient's name, of course we know when we book appointments. I'll share another example on this. I know of a practitioner in Delhi who has a very well established practice with almost 8 to 10 chair practice. And his assistant would make note of each patient. Chair number one, this is the name. Chair number two, this is the name. Now imagine a dentist of that stature. He would go to the chair and he would address the patient, Mr. X, Mr. Y. That again, that feeling of the fact that the doctor remembers my name, or nicknames for that matter. Like for my pedo patients, I always ask the parents, what is the nickname of the child? Would the child be comfortable if I call him or her with the nickname? And children really, they feel very happy that the doctor knows my name, the doctor knows my nickname, or the doctor knows the name of my toy that I am carrying. So these are little things. You can always take a note of these things, which help to strengthen the communication and the connect in future. Now, reminders for appointments. Even though our softwares would be sending reminders for appointments, but along with that, I make sure that my front office manager calls the patients in the mornings, reminds them of their appointments, even follow-up appointments. So one is reminder for an appointment of the ongoing treatment. The other is booking a follow-up appointment. So in my day-to-day practice, I make it a point that I'm booking once the treatment is over. I make sure that I book an appointment 3 months or 6 months later, whenever I want to recall the patient for a follow-up. So that acts as a reminder for the patient also that they need to come back, because once the treatment is over, they would also forget. I would also forget. So the reminders for appointments also, create a very positive impact on the patient, that see the practice is concerned. They want us to be concerned about our oral health, and that's why they are sending us reminders for our 6 monthly appointments. I've had patient complaints saying that the patient came back a year later, even though we told a certain treatment plan, and the patient said we never really got any reminders. Had we got any reminders for the appointments, even if at that point of time we would have forgotten, but maybe a day or two later we could have made the appointment and come for our dental treatment, and it would not have become that worse. So somewhere we want the patients to come to us. It is our practice. We have to build that practice. So this also helps us in a long way. Like I said, become genuinely interested in the patient. Unless you are listening intently to the patient and you show a genuine interest and concern in the patient's problems or day-to-day life, only then the connect develops. And let the patient talk, build a rapport with the patient. One very common mistake, communication mistake that we as doctors make is we make assumptions or we prejudge the patient. How many times, I'm sure all of you, if you think, would have seen, okay, a patient has walked in and you would judge the patient by his appearance and think that, oh, I don't think he's going to get a treatment done. I don't think he's going to pay that much. So again, my press wala, my dhobi, the person who irons clothes for my household, he called me once and he said that, my mother does not have teeth and I'm looking for a replacement. I also prejudged and I thought that, he would not get anything more than a denture. So I, on the call itself, I started talking to him. I said, you can go ahead for a denture for your mother, and with a denture for your mother and everything. And after listening to me for a minute, he said, ma'am, I've heard of something known as those implants that are placed in the bone. And I was amazed. So you never know, I was prejudging. I made a notion and I assumed that no, he cannot afford. And it turned out to be exactly the opposite. So it is our duty as doctors to give all treatment options to our patients. We should not think whether the patient can afford. Looks can be deceptive sometimes. You would have somebody walking in with a very expensive bag, wearing a very expensive watch, and I've seen those kind of patients who would not even be willing to pay the entire amount for a normal cleaning. And patients on the other side who would not really look that impressive, but they would immediately value the treatment and would get converted for that treatment. So do not prejudge, do not make any assumptions. It is our duty to explain all treatment options to our patients, and we have to do it to the best of our capability. And then of course we have to guide our patients to reach the point of decision making, wherein we tell them that this is what is best for you, and then obviously the decision has to be made or taken by the patient only. Avoid technical jargon. I could not make you hear the video properly, but the first dentist over there, when the patient asked what issue I have, he used all the technical terms. You have a periodontal abscess or a periapical abscess, and this has happened and that has happened. Understand. easily. We keep on doing lots of courses, and we think that, okay, we have learned, but the patient is not aware of all those terminologies, all those jargons. So we have to come down to the level of the patient and explain in a language that the patient can understand. So, like, I even if I have to explain a root canal to a patient, I draw the diagram of a tooth. You can use a model, you can use Google, you can use videos. There are so many things. I still like to go by the conventional way. And then, I keep asking questions in between that, did you understand? And, this is what is going to happen. This is what the treatment is about. So avoid technical jargon and use terms which the patient can easily understand. And in the end, commitment matters. Please stick to what you commit. Commitment in the sense that, yes, you are, so never, over promise and under deliver. Always under promise and over deliver. You have to give the facts and figures. Never say that, okay, I am doing this treatment, now nothing is going to happen. That's not practically possible. We cannot promise any of that thing, right? So what we can do is, we can always say that, yes, I will do the treatment to the best of my capability. I will use the best of the material, equipment, and instruments available with me. And of course, then follow up is what that matters. Maintenance is what that matters. I always say maintenance also in two forms. Maintenance in the form that you are taking care of your diet and hygiene, the two factors which are in your control, and maintenance in the form that you are visiting me or any dentist every 6 months, so that we make sure that whatever has been done or fixed is in the correct order or not. So these are a few tips and tricks. Of course, in our masterclass, I'll be sharing more examples, going into further details on how to convert and then how to retain those patients. I'll move on to the next slide. Just a second. Presenting treatment prices. I think it's a very common problem I have heard from a lot of dentists that, whenever you are telling the treatment cost to the patient and the patient says that, this is too expensive, and the patient wants to bargain or ask for discounts. And, how many of us face a difficulty in talking about money? And, at times you would want, okay, let the other person take over that thing. But, how to overcome that problem? Because somewhere or the other, it is our responsibility to talk about the treatment pricing. So there is a very famous author called Ashley Latta, and you can also Google his videos, YouTube his videos on all these things. So from him, I learned this concept of using the term investment, not price, not cost. So if you tell the patient that the investment that you will have to make for your dental health, for your teeth, which are going to be there in your mouth for all your life, which are going to help you chew and maintain and stay healthy and have a nice smile. So, that is when they understand. It's an investment you're making for your health. It's not a cost. You're not buying a commodity. You're not buying a piece of jewelry. You're not buying a pair of jeans. You're making an investment for your health. And that investment takes you, that health, oral health is going to be there for you forever. So use the term investment. Then state all inclusions in the treatment, including the duration of the treatment. Say, for example, now when you tell the patient comes to you, say, okay, I'm going to do braces for you. Say, for example, I'm going to charge you 1 lakh rupees for those braces. Now the patient is only thinking about the 1 lakh rupees. Now, if you talk about what constitutes that 1 lakh rupees, so you tell, it will include a customized bracket kit for you, every follow visit every 3 to 4 weeks for you, the retainers in the end, maybe the 2 scaling sessions that we would be giving in between, and the follow-up treatment, the follow-up visits after the retainer. So, and the lab charges, whatever we would be getting made from the lab. So all the inclusions, that is when the patient would actually understand the value of the price that you are asking from the patient. Or for example, you are saying that I am going to do a crown. I'm going to do a crown for say 15,000 or 20,000. So then you have to say this also includes the cost of the technician. This also includes the charges of the material that will be used. So it is going to go to the lab, the charges that are going to be there in the lab, and it also includes a warranty associated with it. So that is when they will be able to relate to the value of the cost asked. The third and the most important thing is building value of the treatment. So, price, if you read the next line, it may be an issue for the patients to get converted, that it is costly, but it is very rarely the issue. It is it might be a hitch. Okay, the price is costly, it is too much, and I don't want to pay that much, but it will rarely be the issue. If it would have been the issue, the patient would not have come to you. When the patient is going to a practice every day, these days everybody researches on which practice they are going to, which doctor they are going to visit, right? So they know, they are aware. So it is on us how we build value of that treatment. Now, again, like I mentioned earlier also in the beginning of the presentation, say, for example, pedo patients, I face a lot of these issues, especially being a pediatric dentist in my profession, that, patients' parents will come and say, these are milk teeth. They have to fall off eventually. Why should I, get anything done for my child? Ultimately, these are going to fall off only. But at that point of time, it is my responsibility to build value. So that is when I talk to them about the importance of milk teeth, about what will happen if we do not treat the milk tooth, how it will impact the permanent tooth which is lying under, and how, if we treat, it is going to improve the chewing efficiency of the child, how the oral health is affecting the general health of the child and the growth of the child as well. So these small things, when you build value of that treatment, that is when they will not question the price. So price always comes in the end. We never talk about price. There are patients who will come and say, okay, root canal is required, what is the cost? So I always say, let me first explain to you the procedure, how it is to be done, why it is to be done, and then of course we will come back to the price of the treatment as well. Now, by the time you reach the price of the treatment, you have built the value of that treatment. So the patient would not mind or think that it is an expensive treatment. Same way, say for example, for an implant, if you tell them that it is going to maintain the health of the bone, maintain the level of the bone, on how an implant is better than a crown, we are not going to cut the adjacent teeth to make a bridge. That is when the patient will understand, okay, that is why the value of the treatment is this, and hence the price. He would not mind paying. And like I said, under promise and over deliver. And once you are done talking, after listening to the patient, answer all their questions. So I always ask in the end, so do you have any questions in mind? Do you have any doubts in mind that you would like me to answer? Any queries that you would like me to address? If the patient asks something, very well, answer at that time. If the patient at that point says that no, that's all, I also say that in case you come up with a query later, if you go through something or read something and you want to come back and ask me, please, you're more than welcome to come back to me and come back with your queries. So this is on presenting treatment prices. Moving on to the next slide. One more thing that I'll be talking about in our masterclass would be on treating different types of personalities of patients. So, we judge the personality of a patient and, of course, our own self through two elements, the emotion and the assertiveness of the patient. So there are generally four types of personalities of patients: expressive, driver, enable, and analytic. So expressive patients, if I have to summarize in one simple sentence all the personalities, for expressive patients, I would say they would say that I like to have fun in my life. They are unstructured, they want recognition, they're impulsive, they are outgoing. So, they're people who would really love to talk a lot. So when we go ahead in our masterclass, I'll be giving you a couple of examples for each of the personality types. Then moving on to driver. Drivers are, I like to do things my way or the highway. They are result oriented. They want to win. They would say, this is the treatment we want, not the treatment that you have suggested. We have chosen the treatment plan. This is the treatment plan we want to opt for. They take calculated risks and they are really very impatient. Then we have analytical. Analytical patients are the patients who would say, I like to do things the right way. So they are logical, they want to be right, they're careful, they're formal. So, they would say that, okay, whatever is there, whatever is the ideal, whatever is the right way, okay, this is the best implant, I want to go ahead with this one. This is the best, a crown, I want to go ahead with this one. So they basically just want to, they just want to do everything the right way. Then we have amiable. Amiable people would be like, I want to go ahead with the easy way. So whatever is easy, whatever is, not very discomforting, I would like to go ahead with the easy way. They're agreeable, they want to be liked, they value feedback, and they're artistic. So we'll be talking in length and detail on each personality type, on what are the characteristic traits of each personality, on how to handle those personality patients. And in the end, we would also be doing a little quiz wherein we would be assessing our own personalities, because it is said that whatever our personality is, it is easier to relate to people of a similar personality. And then I would in our masterclass also want all of you to come up with different types of personalities that you have seen in your scenarios and how you have handled them. What are the ways to handle all those different types of patients. So this is all about verbal communication. And now I would like to move on to non-verbal communication, which again is a very, very important aspect, because honestly, the non-verbal part comes first. And only after the non-verbal part, we move on to the verbal part of the communication. Just a moment. Just one second. Sorry. Yes. So on the non-verbal communication. Now, the first and the most important step in the non-verbal communication is building your image. Building your image, which is very, very important. Now, what is the image? It is building the brand called you, right? Now, what is a brand? Now, just imagine you see an M written somewhere, or the four rings, or an Apple sign. With that brand, we are immediately able to recognize, okay, that's an iPad, that's an Apple phone, or this is the tick is a Nike brand, or the four rings are an Audi brand, or M stands for McDonald's. So that is what we have to build up for ourselves. We have to build up our image. And what is a brand? A brand is a promise. It is a commitment, right? So you are a promise, you are a commitment, that you have to build your image in a certain way, that wherever you are, whoever you have treated, the patient has to develop that bond, that connect with you, that he says, okay, that I want to go to that particular doctor only, wherever that doctor is, right? So you don't want to be lost in the herd of sheep, right? What a brand does is it differentiates you from your competitors. So that is what you have to focus on. You have to build the brand called you. And how do you do that? You have to do that starting by making the first impression, right? We say people often judge the book by its cover. People often judge the doctor by the first impression. So the first impression is really important. You make it right, make it correct, right? There's a very famous saying. So how to make that first impression? There's a very famous saying that, you will find life still worthwhile if you just smile. So your smile helps to make that first impression. Your smile helps to create that first impression. It breaks all those barriers. I'll share an example from my own life, not as a dentist per se. I was in my BDS first year, and I remember I had my physiology practical exam. And I remember I was obviously anxious and apprehensive about the practical exam. And I entered the room, and I had a smile on my face somehow. And the moment I sat on the chair in front of my examiner, the first thing my examiner told me was that, I love the fact that when you entered, you had a bright smile, you had a pleasantness to your smile, to your personality, to your face. And I'm sure you have the confidence to answer all the questions that I ask you. So, well, that his comment definitely instilled more confidence in me. So somewhere, it's your smile that helps to, create that first impression. And you only get one chance to make the first impression. You do not get a second chance to make the first impression. So smile to begin with. Now, then, to create an impact, what all are the other factors? Your appearance, your grooming, your clothing, right? Your well groomed hair, your warm smile, the feeling of confidence, a formal dress, a pleasing personality, your correct body posture, your clothing. All these things, they end up making the first impression. All these things come before the verbal communication. Now imagine you go to a doctor who is well dressed and who is smart, versus you go to a doctor who is shabbily dressed and who's not even himself looking pleasant. Imagine if you are yourself well dressed, don't you gain confidence in your own self? And when you have confidence and you are good looking, you definitely pass on that confidence to your patients as well. So create an impact. Now, what all will constitute the non-verbal communication? Postures, so we'll be talking in detail about what kind of postures are the correct postures, your arm crossing, leg crossing, your seating position, voice, the tone of voice, the pitch of voice, the loudness of voice, right? Appearance, like we said, clothing, hairstyle, the choice of colors. They don't have to be loud. You have to wear subtle colors. Of course, most of us these days are in our PPs or scrubs, but it is you, your confidence, your speech that should be visible to the patient, and not your loud clothes or your jazzy colors that you're wearing. So how does clothing and grooming affect us? It affects the way we feel, it affects the way we think, it affects the way we behave and act, and it also affects how the other people are reacting to us. Then is the gestures, the hand movements, the winking, the nodding. Now imagine if I'm talking to somebody and the other person is looking here and there, or sitting like this or like this, has his hand here, or scratching his head. You get to know that the other person is not interested. So eye contact. Then we come to the eye contact, your eye movements, your blinking, the connect. When you're looking at someone in the eye, and you are understanding and you're showing interest, the other person would automatically want to share more and more, would develop more and more faith and rapport. Your facial expressions, of course, our face can make thousands and thousands of expressions, so let's stick to the happy ones, the smiling ones, not the when you go to your work, when you go to your clinic, you have to leave everything behind. Whatever stresses you have at home, whether you're fought at home in the morning, you don't have to let all those things come out at your workplace. You have to learn to keep your personal and professional life separate, and you should always have a smile on your face. In the so again, non-verbal communication, it is said that it is an elaborate secret code, which is written nowhere, it is known by none, but it is understood by all and everyone. Now, the last aspect of the non-verbal communication is the art of listening. Like I've said earlier also, become an outstanding listener, become genuinely interested. There are two ways of listening: listen to respond or listen to understand. So listen to respond is, well, I faced something just a couple of days back, and I was working on something, and my son came to me and he was talking to me, said, Mama, this and that, this happened, that happened. And I was just nodding and saying, yeah. And then he said, Mama, wait, Mama, you're not listening to me. So I said, no, I am. He said, no, you're working. You're not listening to me. So you're not, what was I doing at that point of time? I was listening to respond. I was not really listening to understand. So when you listen intentively, again, become genuinely interested in the patient, listen to the patient's wants and needs, only then will you be able to provide solutions. And when the patient would feel that, yes, you are genuinely interested and you're listening, that is when he would trust you more and would want to go ahead with you as your doctor. Now, sit opposite from the patient, develop an eye contact, which is very important, ask a lot of questions, take notes and summarize. So while the patient is talking, always note down whatever the patient is saying, and in the end, you can always rephrase and paraphrase. So once the patient is done talking, you say the entire thing again, just to comfort him that, yes, you have heard everything correctly, and these are the things that you have heard, and then you summarize. never finish your patient's sentences. You have to be patient. Sometimes, if the patient is saying something and you abrupt cut down the patient in between and you complete, that's not fair. Give him a complete fair chance to finish what he's saying. The patient has come to you, it's a completely decayed tooth, while by seeing only, it's a root canal. But let him tell you when it hurts you, how it hurts you. Take a detailed, like the other doctor in the video, take a detailed medical and dental history. Once you do that, after that only you pass on your judgment or your treatment options. So the more you learn, the more you listen, the more you earn. So in our masterclass also, I'll be sharing a couple of videos on listening as well, on how effective listening helps, and how if you do not listen well, at how it goes haywire. We would also be talking slightly about handling difficult cases, problematic cases, where we can have an interactive session on if you had certain problems, on how you handled and what was the result of that, and how maybe we all can collaboratively think and how differently we could have handled that complaint or that issue. So first thing is, whenever a patient complains, never be defensive. If you are defensive, you just end the game there. Again, art of listening plays a very important role there also. So you have to listen intentively. If you listen intentively, only then you can respond and help reach a solution. So, well, thank you so much. That's all. A little brief about how we would be going ahead with the presentation in the masterclass. So we're open to questions if anybody has any. Thanks a ton from my side.
Thank you so much, ma'am, for this amazing session. I'm sure we all have learned a lot, and this is going to help us very nicely and a lot in our practice. So before moving on to the question and answer session, I'll just introduce our participants that we are coming up with this workshop. I'm really sorry. We are coming up with this workshop on 6th of March, 10 to 1 p.m. IST. And this is one online masterclass on communication, the key to a successful dental practice by Dr. Jaina Gandhi. So I request everyone to kindly register for the event because we have limited seats. So kindly do it ASAP. Meanwhile, I request all the participants, if you have any doubts, you can just put your questions in the question and answer box so that we can take up the questions.
Thank you so much, Shravan. Thanks a lot. And I'm sure I would be able to add more when we do our masterclass. Of course, I had to compile everything in brief. I have lots and lots and lots of examples to share from my own personal experience, where I've gone wrong and how I've, corrected myself in those situations. And likewise, I would also want to learn from you all when you share your examples on how you handle different situations, because I believe learning never ends. It's an ongoing process.
Okay, ma'am, so we have one doubt from Dr. Sudeep Upadhyay. He's saying that if we are planning to open multiple clinics, how do we maintain our brand?
Well, that's a very interesting question. Again, keeping that personal touch is very important. I have worked with a chain and I was handling multiple clinics at the same time. So, the main thing that I did at there was that I would make sure that I'm visiting each clinic. I'm making sure that I have a connect with the doctors over there. So, it's very important. A teamwork, a healthy team is also equally important. Now, whatever you are learning, understanding, listening to your teammates also. So, only then you can create that value, talking about your value systems, what you are expecting from, the doctors in those clinics, because you can't be present everywhere all the time. It is not practically possible for you to see every single patient, right? But if you tell them that what are your ethics, what are your values, and what problems they are facing, genuinely becoming interested in your teammates' problems also, because, that it appears to be a very small thing, but believe me, the issues that teammates face together, whether it is the assistant or it is the janitor, who's cleaning the clinic, or it is the doctors over there, the rift they're having, unless there is a positive environment at the clinic. So I have had that experience also, wherein a patient has visited me at one clinic and the patient has visited me at the other clinic, and the patient has told me that the first clinic or the second clinic, the X clinic, had a very positive atmosphere. So you have to help your team build that positive atmosphere. So the only way you can do is by being in connect with them genuinely. So how do we
Ma'am,
make
next question is
Yeah, I was reading that. How do we make a pedo patient cooperate if the kid is hyperactive? See, pedo is all about patience. I practice conscious sedation also. I practice general cases under GA also. I practice cases under ketamine dissociative anesthesia as well. But it is, you have to talk. You have to build a rapport with that child. Now, we are not, even, pediatric dentists are not magicians. So it takes time and patience. I always tell my parents, my pedo parents, my patients of pedo parents, that it's a pedodontic triangle: the pedodontist, the parent, and the patient. All of us have to work together, right? So it might take some time and patience. You have to use different behavior management techniques. Sometimes, it's always, I start with positive reinforcement, but there are times when I have to do a little bit of negative reinforcement also. But the moment you do a negative reinforcement, you switch back to positive reinforcement as well. Give rewards, do not bribe. Lot of times I have seen parents will come and say, okay, we'll buy you this, you open your mouth. You go out and we'll give you this, you open your mouth. So I tell them that, we don't have to bribe the child into getting this done. We have to make the child understand. So in a specific age group, I tell the child, I think you are independent enough to make a decision for yourself. These are your teeth. I show them the teeth, and you have pain and you had discomfort. You could not sleep the last night, and you need this treatment. So I leave it to you to decide. See, I am there to help you, but I can't help you without you helping me. So there are different behavior management techniques. Of course, when you interact with the patient, you get to know and you come up with solutions. But gaining the parents' trust is very important. Once you gain the parents trust and the parents trust you, then and they let you be with the child. So I tell them, you have to allow me to build a rapport with your child. If you are there, if as a mother I am also taking my son for vaccination and I'm standing on his head and look, even though I know the injection has to be given, but I also have that panic stricken look on my face, and the child is also looking at me with that expression, oh my god, something's going to happen. It is not going to help. So somewhere I have to let the child trust the doctor and the doctor trust the child. Make a rapport with the child.
Right. So, moving on to the next question. Dr. Jen is asking, how do we deal with annoying patients who dislike you no matter what?
Be patient. See, they are for us. We are practice runs because of them. So do not lose patience. Right? I have had dealt with lots and enough, even seen some legal cases also, which of course I would go in more detail in our masterclass when I discuss different personality types. But the key is not to lose patience. The moment you lose patience, the blame will come on you. Nobody will blame the patient. The blame will come on you. So keep patient. So again, it comes as mostly such patients are so mostly such patients are basically driver type of patients. So they would say that, no, I have told you I want this particular treatment only. I want a filling done. You are telling, no, a filling is not indicated. The patient needs a root canal, but the patient is hell-bent. So there, you have to patiently explain and then gently, politely say that, I'm sorry, I would not be able to go ahead with this treatment because this is not ethically correct and it can do you more harm. Rest, I leave the decision to you. So whoever is annoying you, don't get annoyed. You can take out your frustration later. Once the patient leaves, you can discuss amongst yourselves, take your anger out, whatever you want to do, but not in front of the patient. So stay calm. So this I would discuss in great detail with a lot of examples on their personality types, their character traits, how to handle each character trait in our masterclass.
Right. So next, all the questions that are remaining, how to do marketing of a dental clinic, any advice about communication skill during consultations, all these questions, I guess we can cover in our masterclass.
Yes, absolutely, absolutely. So marketing, I would just add one line. I would like to add one line. Word of mouth is the best source of marketing. There is no other better source of marketing than word of mouth. And you can do that when you build your own brand. Like I said, the brand called you. Now, of course, to bring in patients initially, there are a lot of things that you can do, flyers, pamphlets, RWA camps, school camps. But once the patient comes to you, you have to ensure that this patient does not go anywhere. Not in the thought process that I have to fleece the patient, but whatever the patient has come for. In the initial days of the practice, I was in one of the clinics, we used to have just 2 patients, 3 patients in a day, maximum, sometimes no patient. We made sure that even if there are 2 patients, I have time, I'm free, I'm going to spend as much time as possible, spend 1 hour, 1.5 hours with that patient. Like I said, building that connect, because that connect, that patient will go back and he will tell 2 other people. And do not shy in asking for referrals. You tell your patients that, we'll also discuss a script on how to say that. Ask your patients to refer more patients to you.
Right. So I guess we are done with our questions today. So thank you so much, ma'am, for being with us, and it was an amazing session. Looking forward for your
Most
masterclass
welcome.
on 6th of March, 10 a.m. to 1 p.m. I request all the participants, you can get your all the questions answered there in detail, and we'll be discussing much more on the online masterclass. So do register for the same. So thank you, ma'am, for being with us, and thank you to all the participants for being so patient. And with this, we are ending today's session. Thank you, and have a great day ahead.